Health insurance. Health insurance is one of the biggest blind spots in retirement because if people retire before the age of 65, before they're eligible for Medicare in our country, the cost can be brutal, $20,000 to $30,000 a year in premiums for healthcare. But what most people don't realize is that right now in 2025, thanks to temporary rules, many retirees are paying much less for healthcare through ACA subsidies. That's the good news. The bad news, the rules are set to expire in 2025. So next year in 2026, the subsidy cliff returns. And if you're not prepared, this could cost you tens of thousands of dollars a year in healthcare. So today, what I want to do is share with you a real case study, explain what it is that's changing, and share what you need to know so you're not blindsided when 2026 rolls around. So first, just to set up this case study, let me introduce you to two people. We'll call them Jack and Sarah. Jack and Sarah are both 62 years old. They retired early. They have income from their investments around $90,000 a year. When they looked at Affordable Care Act health insurance subsidies, the quotes shocked them. Over $2,000 a month, $24,000 a year just for premiums. That kind of cost can ultimately derail a retirement plan. And this, frankly, is where most people stop because people think, you know what? We can't afford to retire until Medicare kicks in at age 65, and people work until 65 as a result. But in this case study, we're going to dig deeper. And here's where the Affordable Care Act subsidies ultimately make all the difference and will make all the difference next year and beyond. So first, let me set up and introduce how the Affordable Care Act works today. Right now, Affordable Care Act subsidies are based on a sliding scale. The lower your modified adjusted gross income, the less you're expected to pay for healthcare. And here's the key. Thanks to the recent laws that have been in place the last couple of years, there has not been a hard cutoff. So there's been no cliff for subsidies. Instead, your contribution for healthcare is capped at about 8.5% of your income. So for Jack and Sarah, by managing their taxable income, they didn't have to pay $24,000 a year for insurance. Their premiums dropped closer to $12,000 to $14,000 a year. That's a huge difference, almost $10,000 a year. And it's all about knowing how the rules work and planning accordingly. Now we have to step in though and recognize what's going to change for next year in 2026, because this is the part that I have noticed that a lot of people just don't know about. Unless Congress acts, these rules are set to expire at the end of 2025. So next year in 2026, the subsidy cliff returns. And what it ultimately means is that if your income is even $1 over the cliff, over the threshold, you can lose your subsidy for healthcare completely. So instead of a smooth sliding scale, you go from paying maybe 8.5% of your income to paying full price overnight because your income was $1 over the threshold. Now, for someone like Jack and Sarah, that could mean going from $12,000 a year, $12,000 annually for healthcare to $24,000 instantly, just because the calendar has turned into a new calendar year. That is more than just an inconvenience. That is a retirement breaking expense if you haven't planned for it accordingly. So let's check in here on what really matters. Everything I'm talking about here today is why planning matters so much. Not because people can predict exactly what Congress is going to do. We can't. But because the rules we're living with today are temporary. If you're 60 or 61 or 62 years old and planning to retire before Medicare age, you might be assuming that the current rules are going to hold. But you'll be living under the future rules when the fiscal subsidy cliff returns next year. And the gap between what you think will happen and what actually happens, that gap is where people can get hurt in their own financial planning. So the lesson here, the truth, is that financial planning is not about predicting the future. It's ultimately about preparing for it. And the Affordable Care Act shows this perfectly. Laws change, subsidies change, costs change. The way you stay safe is not by assuming today's rules will last forever, but by building flexibility into your plan. So to wrap all of this up, right now, the ACA subsidies are generous. If you plan carefully, you can save thousands of dollars a year on health insurance before Medicare. But in 2026, unless Congress steps in, the fiscal cliff comes back. And if you're not ready, that can have a real impact on your financial plan. This, candidly, is why retirement planning is more than just investments. It's taxes, it's healthcare, it's income, it's lifestyle. All of it is connected. And I do not predict I do not pretend to be able to predict the future, but I do know how to help people build plans that can hold up even when things continue to change. So if you are retiring soon, or you're in that Medicare gap and you're looking to retire before the age of 65, this is the kind of work that we do at Falcon Wealth Advisors every day. Make sure you're not building your retirement on temporary rules. Build a plan that will carry you through no matter what comes.